Hi, this is Keith. This is a lecture for Chapter 6. If you have not read that chapter yet, it's a good idea to do that first and then watch this lecture. In this presentation, we'll discuss sexuality in infancy and childhood and sexuality in adolescence. Let's get started. Understanding sexuality development in infancy is through observation and inference, since babies aren't able to tell us directly what's happening. Through observational studies, we know that babies derive sensual pleasure from activities like stroking, cuddling, and bathing. In other words, they get it from tactile stimulation and touch. Now, this does not mean that this sensual pleasure is in any way sexual. It just means that these tactile activities are pleasurable to babies. This is this, of course, might set the stage later for sexual pleasure from touch. Ernest Bornemann suggested that the first phase of sexual development is the cutaneous phase, during which an infant's skin can be considered a single erogenous zone. So the thought is that psychosexual maturity begins to develop in infancy, and this includes learning how we should feel about our bodies. While there are genetic influences on how we begin to form concepts about our bodies, much of our body awareness comes from rewards and punishments from parents and other caregivers during this time. And as you learned in the last chapter, we learn at an early age about the gender roles that we're expected to fulfill. Again, I want to restate that what we know about infant sexual development is through observation and an interpretation of what appears to be their sexual response, and it's sort of interpreted through our adult lens. So it appears that infants discover the pleasure of genital stimulation soon after they're born, but research has detected sexual responses as early as babies are in utero. Scientists have discovered that males have erections in utero, and that among females, vaginal lubrication and genital swelling has been detected soon after birth. So, while interpreting these events as sexual pleasure in infants is an adult interpretation of just normal reflexes, this research does show that there is capacity for sexual response and that this is present soon after conception. As children age, we can begin to get more direct information about their psychosexual development, especially as they begin to talk. Certainly, we know that curiosity about sex and sex play begins at an early age. This can take a lot of forms, like touching their genitals or playing doctor. A well-known physician, Mary Calderon, believes that sexual interest should never be labeled bad, but may be deemed inappropriate for certain times, places, or persons. In other words, we might be able to optimize healthy sexual development by allowing children to explore sexuality, but also teaching them about the right time and context to do so. And by allowing children to satisfy their natural curiosity about their sexuality, they're more likely to feel comfortable with their bodies as adults. We know that adults who experience shame and guilt about their bodies may learn that at an early age. And as part of normal sexual development, children more often participate in sex play with children of their own sex than children of a different or opposite sex. Again, this type of sex play can range widely from playing make believe or showing each other's genitals or other activities. And importantly, there is no evidence that same-sex play at this age is at all related to having a heterosexual or homosexual sexual identity later. Nearly all psychologists, physicians, and child development specialists agree that masturbation is healthy. It is negative responses from adults that magnify guilt and anxiety that a child might associate with this behavior. Now, in most cases, children will accidentally discover that playing with their genitals is pleasurable, not perceiving it as right or wrong. However, by age 4 or 5, they have usually learned that adults consider this behavior quote unquote nasty. And typically, between ages 6 and 10, children begin to conceal their sexuality. So these are important years that can set the stage for how children feel about their bodies. Helping children understand that masturbation is normal and healthy is important as helping them understand that such activities should be done in private. As we've been talking about, parents exert a strong influence on children's psychosexual development. The different styles that a family can take with respect to physical expression, modesty, privacy, and nudity can vary greatly from family to family. Some are comfortable with nudity and physical expression, while other families are more modest. And that's all okay. Studies show that families that have a more modest style can certainly have sexually well adjusted children, but there are a few guideposts to follow. First, there should be a clear acceptance and respect for a child's body and nudity. Second, children should not be punished or humiliated for seeing their parents naked, going to the bathroom, or being sexual with each other. This is part of normal sexual development. And finally, families should respect a child's need for privacy, which may be especially important during puberty. These guideposts can be followed regardless of whether families tend to be more modest or less modest. And finally, families can vary a lot in terms of how they express affection, including the amount and type of physical contact in which they engage. This can include the degree to which families hug and kiss, as well as the amount of physical space that they give each other. Again, there are some guidelines for affection in families. First, all children, and adults for that matter, need freely given physical affection from those they love. This can still vary between families, but unconditional physical affection is important. Second, children should be told, but not in a threatening way, what kind of touching by adults is acceptable and what is not acceptable. This is important to let them know that they have control over their own bodies and that no one has a right to touch them with sexual intent. Third, it's not necessary to frighten children by talking in detail about all of the negative things others might do to them. Rather, it's better to instill in them the skills of asserting their right to have ownership over their bodies. And finally, listening to and trusting children is critical, as is letting them know that they will still be loved if they tell their parents or other adults of any potential abuse. All right, so let's move on and talk about sexuality in adolescence. So, when we think of adolescence, we often think of puberty and the turmoil that comes with it. What is puberty? It is the biological stage of human development when the body becomes capable of reproduction. For legal purposes, puberty begins at 12 for girls and 14 for boys. However, the actual age can vary between individuals for a variety of reasons that we'll discuss. Knowing what puberty is helps us to define adolescence. Adolescence is the social and psychological state that occurs between the beginning of puberty and adulthood. Adolescence is in part defined by biology, but it is really about what happens psychologically and socially during these formative years. Okay, so here you see some important physical and hormonal changes that occur during puberty. As a child approaches puberty, the levels of hormones begin to increase, triggered by the hypothalamus. These hormones, called gonadotropins, stimulate activity in the gonads and are chemically identical in boys and girls. This increase in hormones triggers the development of specific external changes. So in females, the ovaries start to produce estrogen, and higher levels of estrogen result in acne, underarm hair, breast development, rounded body contours, pubic hair, enlargement of the uterus, clitoris and labia, and menstruation. In males, the testes increase testosterone production, and higher levels of testosterone result in acne, beard growth, voice changes, underarm hair and chest hair, muscle development, pubic hair, enlargement of the penis, scrotum, and testes, and sperm mark or the production of sperm. Adolescence is a complicated time. On the one hand, adolescents are physically mature. However, they're still learning about their gender and social roles. And many adolescents struggle to understand their sexual feelings, gender identity, and sexual orientation, especially as the influence of peers becomes more important. And adolescence is a time of many milestones, especially physical ones that are more externally obvious than milestones at other ages. Of particular importance is the milestone of menstruation for girls and the onset of ejaculation for boys. Breast development is often the first sign of puberty in girls and on average occurs around 10 and a half years of age. A person's first menstruation, called menarche, is usually around 12 or 13 years and usually happens at a slightly younger age for black females than white females. For males, pubertal development typically lags 2 to 3 years behind females. According to Kinsey, who we learned about in Chapter 2, a male's first ejaculation is one of the most important milestones. This can occur through masturbation or can happen via a nocturnal emission, or what we colloquially is known as a wet dream. Sometimes individuals can start puberty very early, called precocious puberty. In this case, the appearance of physical and hormonal changes or signs of pubertal development begin at an earlier age than is considered normal. This is typically before the age of 7 for females and before the age of 9 in males. Sometimes precocious puberty can be the result of a medical issue, but it can also have psychological or social implications. The presence of physically mature characteristics can possibly mean that those who are precocious may be pressured earlier to engage in sexual activities before they're really prepared to understand or manage the consequences of sexual activity. Therefore, both the physical and psychological consequences of precocious puberty should be considered. There are a number of factors that can increase or decrease sexual behavior during adolescence, including the influence of parents, peers, and the media. First, thinking about the influence of parents, children and young adults learn from parents. This is usually by observing their parents negotiate relationships rather than directly asking parents about sexual matters. As we touched on earlier, parents can contribute to positive sexual health by fostering an open and honest relationship and by role modeling healthy attitudes towards sexuality. But in addition to parents, adolescents receive a lot of information about sex from peers. However, as many of us know, this information can be distorted or often incorrect. Peers often may endorse and reinforce the double standard of sexual prowess for boys and sexual modesty for girls. Studies show that this double standard can increase the risk of poor sexual functioning and lower sexual satisfaction. And increased sexual activity among teenagers is associated with having friends who are sexually active and friends who are older, also who use substances and who engage in risky sexual behaviors. Finally, as we discussed in Chapter 1, the media exerts a strong influence on our attitudes about sex and about our bodies. However, the sexual hype reflected in the media can be counterbalanced with information about real life. On this slide, you see the percentage of teenagers who say who or what most influences their decisions about sex. Among teens aged 12 to 15, 52% said parents have the most influence, 17% said their friends do, 4% media, 3% teachers and educators, 2% siblings, 1% religious leaders, and 2% somewhere else. And 19% didn't know or refused to answer. Among teens aged 16 to 19, 32% said that it was their parents, 28% their friends, 7% teachers and educators, 4% media, 3% siblings, 3% religious leaders, and 6% someone else. And 17 didn't know or refused to answer. So we know that who influences teens' decisions about sex can also vary by race and ethnicity. For example, 43% of white teens, 54% of black teens, and 50% of Hispanic teens say their parents influence their decision about sex. This is in contrast to the influence of peers, where 23% of white teens, 10% of black teens, and 22% of Hispanic teens say that their friends influence their decision. And parents' influences on their adolescent sexual decision-making can be increased by talking with their child. So here you see the percentage of parents who talked about sexuality with their 12 to 17-year-old adolescent. Among those parents surveyed, 95% reported talking about any topic related to sexuality with their adolescent. 84% discussed sexual risk, 55% discussed sexual desire, 38% sexual satisfaction, and 38% sexual practices. As you see, there's definitely some room for improvement here. As we discussed before, everyone has a sexual orientation. However, adolescence can be a particularly tricky time for gay, lesbian, and queer youth. During adolescence and early adulthood, it's typical that sexual orientation becomes a salient issue for many youth. Some adolescents begin to question or examine their sexual orientation during this time. So this is an age where many young people have sexual fantasies, and some of those involve sex with persons of their own sex or gender, while others may engage in same-sex play. Again, doing so does not necessarily predict for any one individual whether they'll be gay, straight, or otherwise later on. Rather, for some adolescents, this is part of their normal psychosexual development. That said, an increasing number of adolescents are trying or identifying as something other than straight. For example, in 2021, 1 out of 6 youth aged 11 to 28 identified their sexual orientation as something other than straight or heterosexual. This is more than twice as many who did so even 7 years prior to that. Another example is that 1 in 4 high school girls with sexual experience had a same-sex partner compared to about 1 in 10 sexually experienced boys. We discussed heteronormativity in a prior presentation, which establishes and reinforces heterosexual norms among individuals in our society. For many sexual minority youth, this can result in homophobia or the irrational fear of sexual minorities. And unfortunately, homophobia can be perpetuated by parents and schools, which can have quite negative impacts. For example, LGBTQ teens may feel like they can't talk to their parents about their sexual orientation. In addition, LGBTQ youth are more often the victims of assault in dating situations, more often have suicidal thoughts and attempts, use substances at higher rates, and are more likely to be homeless than their heterosexual peers. Now, there is evidence that supports groups for LGBTQ youth can be really helpful, but there's a lot that needs to be done. The impact of navigating these waters is especially treacherous for many racial and ethnic minority LGBTQ youth, who face stigma related to both their racial and ethnic identities, as well as their LGBTQ plus identities. Now, in this slide, you see the percentage of heterosexual and LGBTQ plus students in the ninth through 12th grade who had experienced negative situations or mental states. So as you can see, LGBTQ plus students experience these events at much higher rates than heterosexual students. For example, twice as many LGBTQ plus students report that they did not go to school because of safety concerns compared to heterosexual students. And 3 times as many LGBTQ plus students reported seriously considering a suicide attempt compared to heterosexual students. Another sign of changes occurring in society is evident when we look at research showing the percentage of adults who identify as transgender or non-binary by generation. These graphs show that persons in Gen Z are are especially more likely to identify as transgender or non-binary than prior generations. For example, 3% of Gen Z identifies as transgender male compared to less than 0.5% of the boomer generation and Gen X. Similarly, nearly 3% of Gen Z identify as non-binary assigned female at birth, and approximately 2.4% identify as non-binary assigned male at birth, compared to less than 1% of each in the boomer generation and just over 1.5% of millennials. Okay, so let's talk about adolescent sexual behavior. It's really no surprise to anyone that hormonal changes during puberty are associated with a dramatic increase in sexual interest. However, the degree to which this results in sexual activity is individually determined. So, if children have not already begun masturbating, they will likely begin masturbating at the start of puberty. Among females, masturbation begins later, and the prevalence of masturbation is higher in males in all age groups. So in men, typically masturbation starts at age 13 years, and for women, it's at 15 years. Among adolescents as well as adults, there are many motivations for sexual activity. These can include curiosity, pleasure, and desire. But it looks like teenagers are waiting longer to have sex now than in prior cohorts of teenagers. For example, in 2011, 47% of ninth to 12th graders said that they had ever had sex, compared to only 30% of them in 2021. Likewise, 34% of the same group said that they were currently sexually active in 2011, and that's compared to 21% of teenagers in 2021. Be sure to check out Table 2 in the book for more comparisons of sexuality related events across the years. The percentage of adolescents who have ever had sex can also vary across different demographic groups, as shown here. So when we look at it by sex, males and females have pretty similar rates of ever having sex. And again, this is among high schoolers. However, there's some variation of ever having sex among high schoolers by race and ethnicity. Black and American Indian or Alaska Native high schoolers report the highest rates of having sex, while Asian high schoolers have the lowest percentage. Likewise, a slightly higher percentage of LGBTQ plus high schoolers have ever had sex compared to their heterosexual classmates. Along with lower rates of sex among young people today, teenage pregnancy and birth rates have declined dramatically in the past couple of decades. So, what accounts for that decline? Certainly, access and convenience to contraception are important factors in lower pregnancy rates. Despite these encouraging trends, rates of teenage pregnancy is in the US is still much higher than in comparable countries. Higher rates of teen pregnancy are particularly found in low-income females and females of color, which has largely been attributed to a history of systemic racism that has led to a number of issues like mistrust in the healthcare system and reduced access to contraceptives that drive rates of pregnancy up in these communities. And unfortunately, pregnancies at an early age can lead to a downward spiral effect that can trap people to expect less for the future and create economic hardships that may lead to poverty. Teenage parents are therefore hit really hard with the consequences of pregnancy, with mothers having unique needs around healthcare and education that are often not addressed. And teen fathers are often not in a position to contribute to the well-being of the child, given that they face hardships of their own. Overall, teen parents may feel unprepared and have fewer resources to care for their child compared to adults who have a child. But fortunately, rates of teenage births have been falling for the past few decades, as shown in this slide. For example, the rate of births among 15 to 17-year-olds fell from about 39 births per thousand females in 1991 to approximately 5 per thousand females in 2022. The same large declines in teenage birth rates were shown for 15 to 19-year-olds as well as 18 to 19-year-olds. Now, one way to address teenage pregnancies and births is, of course, through sexual education. Abstinence-only sexuality education has been a focal point in education policy in the US since the early 1980s. However, there is a mountain of evidence that abstinence-only education without a more comprehensive sex education focus is pretty ineffective. And that's why in 2016, teen pregnancy prevention programs were established. These approaches included age-appropriate, evidence-based education and life skills to help teens make responsible decisions. However, cultural and religious norms in many states have impeded the implementation of these teen pregnancy prevention programs. And now there is a more of a push for an even more comprehensive approach to sex education that addresses topics like reproductive anatomy, dating, marriage, STIs, sexual pleasure, sexual orientation, and gender identity. These comprehensive sexuality education methods aim to give students the knowledge, attitudes, skills, and values to make appropriate and healthy choices in their sexual lives. To spearhead this effort, the Sexuality Information and Education Council of the United States, or SIECUS, developed the Guidelines for Comprehensive Sexuality Education. The guidelines recognize that comprehensive sexuality education is a lifelong process of acquiring information and forming attitudes, beliefs, and values about such important topics as identity, relationships, and intimacy. The primary goal of sexuality education is to promote adult sexual health. It should assist young people in developing a positive view of sexuality, provide them with information they need to take care of their sexual health, and help them acquire skills to make decisions now and in the future. And most professionals agree it is one of the most important ways we can help young people become sexually healthy adults. And that is the end of this presentation.